Good evening and thank you for joining us to the eReferrals to the Southeastern Sydney Local Health District and SR Specialist and Referrals webinar. My name is Alex Dolezal and I am the Digital Health and Quality Improvement Team Leader in Central and Eastern Sydney PHN. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water and community and pay respect to elders past and present. I'd also extend that respect to any Aboriginal colleagues who may be joining us tonight. Please note this session will be recorded and will be available on the SESPN YouTube channel within the next couple of days. At the end of the webinar, an evaluation survey will pop up on your screens and a follow-up email sent tomorrow. We appreciate your feedback. Please complete this to allow us to issue your certificate of attendance. We will be using the Q&A function this evening. Question and answer session will follow the presentation. I'd like to introduce tonight's speakers. Kristen Marie Murray is Change and Communication Manager, eReferral Management Project, Prince of Wales Hospital. Siddharth Ramani, the eHealth Project Manager, eReferrals, eHealth New South Wales. Eric Dunn, Digital Health Consultant, SR Specialists and Referrals. Eric has worked in technology industry for more than 25 years, with the last 9 years focused on digital health. As the Digital Health Manager at the Sydney North Primary Health Network, Eric led digital health project focused on My Health Record, secure messaging delivery, and telehealth. Eric is currently working with 7 Media and SR Specialists and Referrals, implementing the expansion of eReferrals between general practitioners and private specialists across the country. Aaron Subak, Project Manager Digital Health, the Southeastern Sydney Local Health District, will join us during the question and answer session. Thank you.
Good evening, everybody. I hope everyone can see my screen. Good evening, everyone. My name's Kristen Murray, and I'm the Change and Communication Manager for the Engage Outpatients project at Southeast Sydney. I'm here to discuss tonight the electronic referrals at Southeast Sydney Local Health District. So what is electronic referrals? Some of you may or may not be aware of the Engage Outpatients program. It's a new statewide e-health solution which has been developed in collaboration with eHealth and the Ministry of Health to improve the referral pathway for patients, referrers and clinicians, obviously in the outpatient services. It consists of 2 solutions. There's the electronic referral management system. This is the hospital-based system in which we manage, receive and manage the referrals. The second component is the electronic e-referrals, the electronic referrals. These are electronic e-forms which are being developed, which are sent directly into ERMS from your referral practice software or the My Healthlink portal. These electronic referrals are an electronic document that is securely sent, and it is replacing other methods such as faxing and posting paper referrals. Through this process, referrers and patients receive notifications of referral outcomes. This is a really high overview of the platform. So starting with the GP and the referrer, with the patient, they launch into the Healthlink form, which is integrated with the practice software. Once all the information and the criteria is completed, this is sent securely through to ERMS. And this is where the hospital manages the referral through each phase. So there's 5 phases of that referral process. It comes into the receive state where the admin review the referral, check all the details against the medical record number. If everything's okay, they move that through to the screening stage. This is an additional stage where further checks can be made. Once this is all okay, and they can assign it to a clinician who can triage that referral, that has that duty, that referral is moved through into the triage phase. This is where whoever the staff member, the clinician, the registrar who is responsible for the duty of that triaging can access ERMS and triage this referral. It is a really simple and quick process, and making it quite timely in processing this referral through. Once that's completed, it moves through to the post-triage admin, which returns to the administration, where that referral is, if it's clinically triaged appropriate, it can be put on a wait list depending on the specialty, appointment can be made, or if the referral is not accepted, that's when the referral will be notified. We are the first LHD in New South Wales to have full EMR integration. So once that referral is processed, that referral moves through into EMR where we have access to that referral. So Prince of Wales is now accepting eReferrals. In November last year, we went live with electronic referrals in the adult outpatient department. We have seen a really strong and steady growth in the number of referrals that we are receiving, but we're really looking for your engagement in improving this if possible. We've seen a steady increase in the number of GPs that are coming on board, which is really good to see. One of the key benefits of an e-referral is the processing time. If you are able to send us an e-referral, we can process it within 24 to 48 hours with notifications sent to you immediately to your practice software. Whereas the fax referrals do take significantly longer. It can take up to 7 days depending on the referral, the specialty that referral is received into. Oh, sorry, I've just jumped across there. So there's some really key benefits for not only you as referrers, but for your patients. The improved patient experience. As a referrer, you'll have a better visibility of the services that each facility provides. There's a faster processing and triage of referrals. There's notifications to the referrers and patients of the referral process through each phase. With faxed and paper-based referrals, there's the opportunity where faxes can be lost, misplaced or misdirected. This ERMS system allows the referrals to be managed in one location, therefore avoiding this issue. Improved quality of referral information. These e-forms that have been developed by eHealth, which are accessible through Healthlink when you launch these forms, are specifically created with all select criteria that needs to be completed. And if a specialty does have a statewide referral criteria that has been developed by Ministry of Health, that is embedded in these forms. So we're ensuring that we're getting all the correct information to enable a faster and correct triage of that patient's referral. It's minimalising paperwork and processing of fax, and it is definitely a faster intervention and a better health outcome for your patient. We've had some really good feedback from the GPs that are utilising this. Currently, Healthlink is used for a wide number of reasons, driver's licence assessments, MyCare health referrals. So this is an added functionality that can be used within Healthlink. We've had some really good, the feedback here, I've just highlighted a few keywords in regards to some of the quotations we've been provided, just that it's easy to use, it's very convenient, the patients are more satisfied with those updates that you're providing. You're getting a real understanding that you know that that referral is getting to that specialty and that it's not floating around somewhere else. So as I mentioned, in November 2023, we went live with 24 services at the outpatient department, and these are a list of the services. So it is quite extensive, and a lot of main services and specialties that we offer, such as orthopedics, fracture, gastro, plastics, where e-referrals is the preferred method of referring into these services. And we really are looking for your engagement in utilising this functionality and referring into these services with utilising the electronic referrals. So what's next with South East Sydney Local Health District? So on the 8th of March, a business case was approved for further rollout across the district. And the potential services that we are looking to deploy from June 2024 is we've got Sutherland Hospital, which we're focusing on 8 services within their centralised outpatients department. We've also got the Royal Hospital for Women, and we've got those 4 main services: antenatal, gynaecology, fertility, gynaecology, oncology, colposcopy. And we're also looking to further extend and expand at Prince of Wales with coming on board with respiratory, diabetes and physiotherapy. I will like to mention here at this point the current process surrounding antenatal at Royal Women's. Currently, the process is for referring into the Royal Women's. There is an opportunity for an online booking form. The Royal Hospital for Women are looking to move away from this referral method, and the preferred method will be an electronic referral through your Healthlink. The same will apply for gynecology at Sutherland Hospital. The facilities are working towards moving away from those faxes, and eReferrals is the ideal and preferred referral method. I'd like to move you over to Sid, who is going to provide a demonstration of Healthlink and give you a far greater understanding of this service. Thanks, Sid.
Thank you, Kristen. Good evening, everyone. So I'll just share my screen. Are you happy to continue sharing? Oh, yeah. There you go, sharing my screen. Thank you, Kristen. So yeah, we're very excited to be presenting about eReferrals today. As Kristen highlighted, the eReferrals have very tight integration with all the practice management software. You've got Best Practice, Medical Director, and Genie listed here, but there are a few more. And you can visit the Healthlink website to see which practice management software are compatible to find out more. And if your practice management software isn't listed there, you can always still use the Healthlink web portal to refer into Southeastern Sydney via the Healthlink Smartforms. Healthlink is free of charge and easy to use. So we'll take you through the demonstration now. Bear with me. So a few call outs. What you're seeing here is on the screen is the demo site. So it won't be just as busy. But when you launch Healthlink from your practice management software, you'll come to a landing page like this. But there will be fewer links, and you'll see a link like this one, which indicates the New South Wales outpatient referrals, Southeastern Sydney. And when you launch this, you would be in the patient context already, and all of the pre-population would have happened at this point from your practice management software. And then you'll arrive at the list of services that are live at Southeastern Sydney. For the purpose of the demonstration, I'll show you the endocrine form. It's a specialty form. So you can see here the Prince of Wales Hospital and Sutherland Hospital are the options. So we'll just launch for Prince of Wales. Once you select that, you'll come to the form, and while that's loading, what's happening in the background is it's pulling the clinicians that are part of this clinic, and you're able to either make a named referral or select unnamed referral based on your preference. Most of the interaction of the form is in the requested information tab. And what we've done in our design process is we've had a panel of both GPs and also a panel of clinicians providing the clinical input across the LHDs across the state, providing us the clinical input. So you get a standardized referral criteria and the embedding of the statewide referral criteria, like Kristen mentioned. So most of that interaction happens in the requested information tab. And along the side here, I'll quickly take you through all the other tabs that allow you the advantage of pre-population. So attachments and reports, you're able to pull through all the reports that are relevant and make a selection, or you're able to load any reports or attachments that may be available on your PC. Similarly with medications, allergies, and alerts. Same with the medical, social, and family history, and the patient information also pulls through, and also the referrer information. And there's also an option to select, if you're not the regular GP, you can select that and populate further details. Coming back to this tab, quickly walking you through, we touched on referred to, so you're able to make a named referral or an unnamed referral. Referral date is defaulted to today. Referral type, new, updated, or continuation. There's also referral period, which is the referral validity, 3, 12 months or indefinite. Referral priority, this is an opportunity for you to provide your assessment on the urgency. The LHD will make their own assessment of the priority, but this is an opportunity to communicate the urgency of the referral. Just a note on selection of rapid access. If you do select that, we encourage you to associate that with a phone call to the facility. Then you've got patient availability at short notice and virtual care compatibility, and any third-party compensable if that applies. And then we come to the health pathway section here. These health pathways sites are embedded here. They launch and take you through to the health pathways page for that particular for the LHD, and you're able to go to the specific clinic details in there as well. So we do strongly encourage usage of the health pathways to see if there's any additional criteria on top of what's embedded in the form. So yeah, please always refer to that. Coming to reason for referral, this is where the specialty form becomes more functional. As you can see, when you select the condition, you're prompted with the required supportive information. And we don't want to hold back any referrals, so we do ask if all of the information's supplied, or you're able to attach it. And if you're not able to, we do ask for a prompt on why, if certain reports are ordered and waiting on, or if that's not applicable in this particular case. Additional referral details, and you're also able to provide your narrative in there and load any consultation notes that you might have taken and that are relevant, and attach them, and also be able to edit them after you've attached it here. There's a little icon that shows any additional information that may be relevant for this referral. And then you can populate the further narrative that's relevant for this particular referral. Conditions to risks, barriers and access, they're all defaulted to no to allow faster completion of the form. And if you do find that any of these are relevant for the referral, when you select yes, it asks you to populate further information. Otherwise, you can continue to progress to completion of the referral. One point I missed mentioning is the mandatory fields are marked by the red asterisks that you can see here, and the referral will not progress to the next stage unless you complete the mandatory investigation, mandatory information fields. Then we come to the patient consent, which is also mandatory, and it's the consent that the patient provides to be able to send the information from the Healthlink Smartforms into the LHD systems, and also consent to being contacted either via SMS, phone, email, or by letter. Upon completion, you're able to either preview, at which point it'll call out if there are any issues with the particular referral, or you're able to do a preview of the referral. I think one of the attachments may be faulty there because it's in the test system. So you're able to preview the referral. And this is what essentially the local health district will see on the way in. you're able to preview it, park it if you're still waiting on some information, or hit submit, at which point it'll trigger the referral through to the LHD. And at that point, you'll start receiving notifications. I might jump back to the presentation, just talk you quickly through the notifications. So switching screens. Moment. So you get notifications upon receipt, and notification on hold as well. And there's opportunity. So when the LHD determines that they need additional information to process the referral further, they can put the referral on hold, and they can send you ad hoc communication. So you get notifications all along the way. And you get notifications if it's accepted, or sorry, not accepted. If it's accepted, it progresses to the next stage. You and the patient will also get notifications if the referral's been redirected for whatever reason, or if the referral's reassigned, and if the triage outcome is accepted or not accepted. And finally, you'll get notifications, and the patient will also get notifications if the referral's cancelled for any particular reason. A bit of how the notifications look. So it generates from the system and has the narrative of what's required. If any, say you get referral receipt, referral placed on hold, referral triage, and referral cancelled. And this is kind of where you would see it in your practice management software. It'll sit in the patient context, and you'll be able to see what this notification is about, and if there is additional information required or requested by the local health district. Another key point to note, we're working on a feature with Healthlink, and this is called the referral update feature. So you'll be able to look at any open referrals within a patient, for a patient, and you'll be able to send an update for that particular referral. So if you find that there is more information available that's become available, or the patient's circumstances change, or if the local health district requests you for additional information, you'll be able to use this feature and send it through. This streamlines the ability to send the information, and it takes it atomically to that specific referral that this information is relevant for, and this makes it simplified and error-free. A timeline, we're looking at another webinar demonstration that we'll schedule for June 2024 at this point. So yeah, keep your eye out for this feature, and we're very excited to be working on this one. Here you've got resources, a number of different websites where you can find additional information on the scope of clinics at the Southeastern Sydney, or you can also use the health pathways as you currently used to, and you will continue to send communication via newsletters and emails. And there are also links to the Healthlink resources and the relevant practice management software. So if there's any questions, you can also reach out to us on the contacts listed here. That brings us to the end of the presentation. I believe I'm handing over to Eric at this point. So I'll stop sharing.
Back to Kristen, I think.
Oh, back to Kristen.
I think everything has been covered. Thank you very much for your time for tonight. And we do hope that please reach out if you have any further questions surrounding eReferrals for South East Sydney Local Health District. But handing over to Eric now. Thank you everyone for your time.
Thank you.
Just sharing my screen. So, hi everyone. As Alex mentioned before, I've been in information technology for over 25 years, the last 9 in digital health, 4 years as the digital health manager at the Sydney North Health Network. I now help specialists and GPs with eReferrals. I now work with Servan Media and SR Specialists and Referrals. You're probably quite familiar with the Medical Specialist Directory, which is a book that we've been producing in Australia for 24 years now. It usually gets posted out to all of the GPs. So this specialist directory is now integrated into your practice software and linked to the Healthlink Smartforms. Referrals to private specialists. So I'm going to get straight into a demonstration. I'm going to start with best practice. So I'm just going to open I work with a live system. So this is a patient file in best practice. I'll just maximize that. And I've got a couple of notes in there. To get into the Healthlink Smartform, you click on the HL button at the top here, or you can go into View Healthlink Forms, but I'm just going to click straight onto the Healthlink button here. And this brings up the Healthlink Forms browser window, and on the bottom section is the links for the referral services that you are familiar with at the moment, and just above that is the specialists and referrals refer to private specialists. So rather than talk about the forms a lot, I'm going to talk about the specialist directory and how you can search for specialists. So when you click on this link, it takes you to, instead of taking you straight to a Smartform, it takes you to a browser for the specialist directory, which gives you complete access to the specialist directory Australia-wide. But typically you're only interested in specialists in your region, but you might want to refer to other specialists, or private specialists. And as we go down this page, you can see there's a search box at the top. And then as we scroll down, there's some recently profiled specialists. Just under that, there are quick start guides that you can download. Each one is about 14 pages long for best practice, medical director, and Genie. We'll have Zedmed in there soon. These are detailed guides on how to do a referral to a private specialist. Then there's a little video on it, but more importantly, down the bottom are our contact details. So our contact details are built into your practice management software with our phone number and an email and our web address. So if you know the name of your specialist, you can just type that in, or you can select a category. So let's select a category for now. Let's say we go for pediatrics, and maybe Wentworth Point, and a 10-kilometre range there, and I'll do a search for the specialists. And that'll come back with a list. So as we can see here, we've got results of pediatric related, Wentworth Point, New South Wales, 103 results. I can tick the boxes for urgent appointments available or telehealth, and that will either increase or reduce. And as you can see, we have groups like Doctor Pediatrics, who also have telehealth, who are just telehealth. We've got Professor Simon Clark, who's a manual referral, which makes the point that if the specialist is not on Healthlink, then you can still do a manual referral and then send the referral in through the previous channels like email and fax and so on. Here we've got Dr. Gavin Vajja, and as I scroll down, you can see that there's some more that have manual referrals. The ones with the pictures on them, they have paid for a premium listing. So they're probably more likely to have capacity. I doubt that they would advertise themselves if they didn't have capacity. So let's have a look at Dr. Gavin Vajja. As you can see, I've got an email patient button here. So let's go and view the profile, and that email patient button will also be in here. So if I want to email the information on Dr. Vajja to the patient, I just click on this button, and then I can put in the patient's email address, and then I can send that. And what they will see when the patient receives it is an email like this. And that email will have a link directly to Oz Health Pages. So you can see your GP has sent you the profile of Dr. Gavin Vajja on Oz Health Pages. Click here to view. So when you click on that, it takes you to Oz Health Pages, which is the public-facing version of the Medical Specialist Directory. And it has the phone number for the specialist, and all the information on the specialist the same as you see on your practice management software. But what can happen here is the patient can then click on the phone number and have the contact details directly for the specialist. The home of Oz Health Pages looks like this, and you're welcome to use that as well if you want to look up specialists or direct your patients to it. Okay, so also here I have add to frequently used. I can report clinic updates, and I can print a patient handout if necessary. As I scroll down about this, it gives me all the information about this specialist, what his credentials are, where he's situated, phone number, fax number, etc., and a little map. And of course, down the bottom are our contact details if you have any issues with this. If I go back to the main search, you can also search by keyword, so you can put in pretty much anything you like. Or as I said before, if you know the specialist name, you can put that in. You'll notice that I have frequently used specialists here on the left, as well as view specialists, my recent searches, and full lists. The lists are up the top here. So if I click on list, then it will bring up my recent searches and my frequently used specialists. If I then go back to search, you'll notice I'll show you how you can practice with this. So if you want to send a practice referral, you can use this Dr. Earlobe. And this is a test one, so you can do this as often as you like. So once again, you need to be in a patient file. So please use a test patient and send it to, because you'll be sending it to us. You'll notice that the same things are here. I can add to frequently used, email the patient. I can report clinic updates, which means that if there's, some recent information about that specialist, you can send it to us and we'll update their profile. If I click the eRefer button, it will then take me to these addresses. And the same thing when you eRefer to a specialist, if they have multiple addresses, you have to pick the one. So I'm going to send this to the portal, and that will then bring up the Healthlink Smartform that will be pre-populated with the patient data. This is quite a simple smart form, and it will eventually get there. There we go. And I'll just quickly run through this. I can bring in my consultation notes. So there we go. And these are today's notes. So I'll put those in, and it puts them in, and they are free text. So I can alter them, and then I can add additional notes. The same thing applies. You just work your way through. I need a date. There's a referral period. I can mark it as urgent. If I want it urgent, then I have to give it an urgent why it's urgent. Then I go through attachments and reports. I can attach existing reports, and I can browse for local files. whoops, I need to pick one. And I'm just going to put an X-ray in there and see what that looks like. Open that up, and then at the bottom it will tell me that I have put that in there. So down the bottom it'll say local file attachments. Also, it'll tell you what you can attach here. And larger attachments take significant time to preview, so smaller attachments are better. If you don't see what you need here, it could be that the date range, you need to go back. This, I think, takes you back 3 years. If you want to go back further, you can then browse for other documents that are in the patient file and go back further than 3 years. Then with the medications, they are automatically ticked with allergies and warnings. Once more, I can bring in more if they're in the file. The medical and social history is not ticked by default, so you have to pick the ones that are relevant. Then the patient information should come through from the patient file. And the referrer information, of course, is you. Please make sure your practice name is correct. If it isn't, then ask your practice manager to fix that up. Then you can preview that, submit it, or park it. You might want to park it if you're waiting on results. If you want to see if there's anything you've missed out or any errors, then hit preview. It'll process it and show it to you with any errors. And I don't have any errors. I've put it as urgent. I can submit it from here. And I can see down the bottom here that I've got some files that are attached. Or I can close that and submit from here. And then when it's submitted, it'll come back and say form submitted. And if it's green, it went through. It doesn't mean they've looked at it. It just means it went through. So here you go, green, form sent. And if you end up with any errors here, you're welcome to call us and we can chase it up for you. So I'll just close that and then go and have a look at where that came out. So I sent that to the portal, which is the Healthlink portal. And this is the Healthlink portal. So a specialist might have this, or they might have software like Genie, in which case it goes directly into their software. I'm going to log into the Healthlink portal and check out the one that I just sent. And here it is, Dr. Happy-Go-Lucky. I think that's the one. So this will have, and you'll see that the PDF, it's one PDF with everything in it. So you can see there's the referral, the patient's name and information, including their phone numbers, the residential address, the postal address, who it was referred by and who it's referred to. The second page with any additional information, as well as the X-ray, and also all the attachments in one document. Okay. The next thing I wanted to show you was if you happen to send it to what a difference it makes for the specialist at the other end if they have Genie. So I'm just going to go into Genie and show you so this is Genie. I'm not in a patient file. If I go open incoming letters, this shows the incoming referrals. If I open this first one here, and by double clicking on it, it will open it and then it'll show me that this is a referral. And there's 3 red crosses here, or not equals. That means it can't find a patient in the system. So I need to create a patient file for this one, and it's very easy to do. I just click on the new button and then it will create a patient file from the referral with all of the information in there. I just save it. So that's created the patient file, and now I have the 3 green ticks, and then I'll just link this referral to that newly created patient. And then it takes me on to the next one, and you can see this has 1 not equals but 2 other equal signs, so I can just link that. and then it says it's not an exact match. Okay, I know that's the right patient. I'll just link it and so on, and then it works your way through it. So it's very simple to do. It's a great thing for when they receive it at the other end. And lastly, I'll just show you what it's like in Medical Director. So here we have Medical Director. It's logged me out, so I'll just log in. And I'm in a patient file in Medical Director, and you can see I'm in my progress notes at the moment. So I just go across to the tab at the top right here, the Healthlink tab, click on that. You can see all of the record forms here. So if I go new form, it then brings up the same browser that we had before, and then I can go into Specialist Referrals and find a specialist and send them a referral. Now, once you've sent the referral, in Medical Director, it comes up in your correspondence in here, which is where we are now, and it gives you a cut down version of it here on the right. If you want to see the full PDF version, you just click on Open Externally, and then it will run a PDF viewer and show you what it looks like. And there it is. The same thing applies in Best Practice. I'll just go back to Best Practice, and which is here. I'm back in, and we can see in Best Practice that I'm in Correspondence Out. If I go to Correspondence Out, and you can see that 11th of the 4th today, this is the one that I just sent. It's going to open in a second. There we go. And so that's where it goes. Now, if you parked it, you'll want to go to View, Healthlink Forms, and this brings up all of the Healthlink forms and with a date range and their status. I want to see the ones that are parked, and I've got one there. So now I just double click on that and it'll take it back into the smart form exactly where I was with all of the data in there, so I can then finish the form and send it. And that, I think, is it. Thank you very much. I will just go back to my slides and just finish off by saying we provide extensive free training, and we're happy to contact the specialists you refer to so they can use SR as well. Because whatever their workflow, we can help them integrate SR so you can both reap the rewards of electronic referrals that work. And these are our contact details. Please feel free to call us or email us with queries or for training. We're sensitive to your requirements and admin processes, and I'm sure our tools will make your life easy. The only thing that I wanted to add to that was that, of course, there is no charge for GPs to use this service, and the training also is free. So thank you. I'll hand back now.
Well, thank you to Eric, thank you to Kristen and Sid. And now the Q&A session is open. So if you want to use the Q&A function, now's your opportunity to ask questions. And I would just like to make an observation. I was looking at some statistics earlier today, and I've noticed that today, since beginning of the eReferrals in Prince of Wales going live, which was, I believe, late November, 152 sites have made over 1,300 electronic referrals, which is a great success. But as I was saying, please use the Q&A functionality to ask your questions. I use Helix, the cloud-based medical director. Can I use the eReferrals?
To the best of my knowledge, it is not integrated as yet.
You're right. It is not integrated. Those GPs will have to use my Healthlink portal, but talking to medical director Telstra Health, Helix is apparently going to be integrated in later in 2024. Do we have any questions in the chat yet or not? No. Okay, I'll have a couple of more. I'll just raise a couple of more. Are electronic referrals following the statewide referral criteria? I think that might be more for Sid and Kristen.
Yes, yeah. Electronic referrals following gastroenterology has been released. Gastroenterology second release is also coming up. Ophthalmology statewide referral criteria is also coming up. So we've built a form for that as well. So yeah, they're embedded into the referral criteria that I was showing you on the form. So when you select your reason for referral, it comes up with a statewide referral criteria. It even asks the question if it does match it or not. And again, as we don't want to hold back referrals, we ask the question and allow the opportunity to provide the context of why it doesn't match, and then we progress the referral through. But yeah, it's embedded.
Thank you, Sid. We finally have one participant putting in a question, and that's, do you provide any tutorial online for training? And I guess that would be both for the Southeastern Sydney Local Health District and Eric.
So we have the Quick Start guides that are built into the directory when you go in there. And so, yes, you can download them and they're quite comprehensive. And apart from that, we provide training where we have a team of people. You give us a call and organise a time and we'll do a Zoom call with you.
In similar fashion, we've got the Healthlink resources on our websites, on the Sydney, Southeastern Sydney website, as well as the New South Wales Health website as well. And you've got the PDF guides and video guides, and you can also call Healthlink for technical support and support with regards to training as well.
Excellent, thank you. Another question is there a copy of the recording so that we can review again? I will probably answer this one. If you're talking about the recording of this particular webinar, this webinar will be placed on the YouTube channel in several days' time, and you will get notification when it's being put up. There is another question again around the tutorials and training, and it says, can I have demonstration in my practice, and how do we organize it? I think, Eric, you might have already answered part of it before.
Yeah, so you can just call us on 1-800-147-047 and we'll organise it for you.
And as far as the Prince of Wales goes, would you be able to reach out to that particular GP, or would you like us as the PHN to support the GP in this respect?
No, Alex, we're more than happy. If you wanted to reach out specifically, we're more than happy to work with you.
I'll definitely give you the GP's name tomorrow. Okay, thank you. Do we need a copy of a referral to the patient, and does the specialist contact the patient directly? I believe that will be probably for you, Eric.
Yeah, so we can't control the response from the specialist, the private specialist. So you can see that the referral has gone to them, and typically we encourage them to keep an eye on that and respond to them, but we can't force them to do that. So generally you can print a copy of the referral and give it to the patient and ask the patient to contact the specialist.
Thanks,
or you
Eric.
can email it to them.
Thank you. I will have a look if we've got any more questions in there. Can one send referrals across different LHDs?
Yes, so there are 4 LHDs live at this point. So you've got Southeastern Sydney, Central Coast went live day before yesterday. Illawarra Shoalhaven went live. and Blacktown, but the same referral can't go to multiple places. Once the referral goes to, in this case, Southeastern Sydney, they will determine if they're not able to provide that particular care, and if there's an alternative, they can do the redirection, provided the other facility is also using the system. But yeah, that could happen. I'm hoping that answers the question.
And just to add on to this, Sydney
Yep.
Local Health District has been using this system for the last 4 or 5 years. So Sydney Local Health District was probably the first in the state to start this. And yes, majority of the facilities would be online for Sydney Local Health District. I think we've got majority of our
Can I just add a
questions.
caveat to that?
Sure.
It depends on your geographical location as to what links you get in the referral services on the smartphone browser. So you may only have one LHD on your smartphone browser. If you want the others, you can ring a Healthlink and their numbers at the top of your browser and ask them to give you access to the other LHDs.
But I can mention, just to add to this, in Central and Eastern Sydney PHN, I know that Sydney Local Health District enables the forms for any GP, regardless of the in Sydney Local Health District or Southeastern. And I've got a feeling that for the Southeastern Sydney Local Health District forms, they would be statewide, wouldn't they?
Other than Western Sydney, all of the releases that we've done with Healthlink have been statewide as well. So.
Cool.
Okay. I've got one more, and that's a tricky one. I am not sure I think it might be for both Eric and for Kristen and Sid. And that's, once a referral is generated and sent to a specialist, is there an option to CC the same referral to other parties? For example, patient, case manager, outpatients, and do we get notification that specific party has received referral?
I can start by saying the referral goes into your correspondence out, so you can then take that referral and print it or email it or whatever you want to do with it. So you can give a copy to the patient, the case manager, etc. For the private specialists, you don't get currently you don't get a notification, but we are currently training the specialists to do a manual notification back to the GP, but there's no specific requirement and there's no automatic, but apparently it will be coming soon with Healthlink.
And in Southeastern Sydney case, yes, you will be able to do the same functionality that Eric's called out in terms of printing out or forwarding or emailing to the patient. And you get notifications as soon as the referral's received. It's automated notification, and the patient also gets notification once it's received, and then at various stages. So.
Thank you. Well, I think as far as the questions in the Q&A, I believe that is all at the moment. I know we are about 5 minutes early, but I think we had quite a number of questions, and they were all answered. So I would like to thank to the speakers and attendees for participating in tonight's webinar. I would like to remind you to complete the online survey that will pop up in your web browser. Also, for that particular GP who was interested in having a look at this recording, it should be available in several days, and I think you will get an email to that effect. Thank you, and we look forward to seeing you online soon again. Bye.